The use of beta blockers in the management of heart failure is a therapeutic paradox. In this video lecture, we will learn the paradox of beta-adrenergic blockade in the management of heart failure. In my earlier lectures, you have learned that in heart failure, the heart fails to pump adequate blood to meet the body's metabolic demands, causing a decline in cardiac output and reduced ejection fraction. Inotropic agents such as digoxin improve the contractility and helps to restore cardiac output and maintain perfusion to various organs. Beta blockers, on the other hand, inhibit the beta-1 adrenergic receptors of the heart, preventing the action of catecholamines on the beta receptors, thereby decreasing the contractility, heart rate, and producing actions opposite to that of inotropic agents such as digoxin. Yet, beta blockers are very useful in the management of heart failure because several studies have proved that beta blockers produce improvement in ventricular function, including the ventricular contraction, the ventricular relaxation, and therefore these drugs are widely used in the management of heart failure. So let's delve into the pharmacological basis of use of beta blockers in the management of heart failure. So let's understand how beta blockers are useful in heart failure. The chart drawn here shows the effects of sustained activation of sympathetic nervous system, which is one of the compensatory mechanisms that are stimulated in response to a decline in cardiac output. Excessive activation of sympathetic nervous system can increase the cardiac workload, increasing the contractility, heart rate, increasing the myocardial oxygen demand. Beta blockers, by inhibiting the sympathetic nervous system, decreases the cardiac workload on the heart, the myocardial oxygen demand decreases, the ventricular filling phase is increased, the diastolic phase is increased, and this improves the myocardial performance. Secondly, increased actions of catecholamines can cause cardiac remodeling, and this is characterized by change in the size and shape of the ventricle. This can cause cardiomyopathy, which is hypertrophic cardiomyopathy and dilated cardiomyopathy, and because of cardiomyopathy there is a decrease in the myocardial performance and a further decline in cardiac output. Sustained activation of sympathetic nervous system can cause death or apoptosis of the cardiomyocytes. There is proliferation of fibroblasts causing fibrosis in various organs. There can be endothelial dysfunction causing oxidative stress and free radical formation, and this has damaging effects on the myocardium. So beta blockers, by inhibiting and controlling or preventing the actions of catecholamines, can reduce cardiac remodeling, can reduce ventricular remodeling, and delay the progression of heart failure. So beta blockers, by preventing the actions of catecholamines, can delay the progression of myocardial contractile dysfunction by controlling ventricular remodeling. Thirdly, increased sympathetic stimulation can increase the risk of arrhythmias in heart failure patients. Beta blockers is the preferred choice of drug in atrial fibrillation. It increases the refractory period at the AV node, reducing the transmission of impulses to the ventricle and helps in controlling the ventricular rate. Also, beta blockers is the preferred choice in heart failure patients with myocardial infarction, because in myocardial infarction the patients are at increased risk for developing arrhythmias. So beta blockers, by reducing the automaticity, controlling the ventricular rate, reduce the risk of arrhythmias and is very useful in heart failure patients with arrhythmias. Lastly, inhibition of sympathetic activation also prevents inappropriate activation of renin-angiotensin-aldosterone system, decreasing the formation of angiotensin II, decreasing the formation of aldosterone, because excessive angiotensin II action and aldosterone action increases the preload, afterload, and has detrimental effects on heart failure. In this way, beta blockers, by reducing the cardiac workload and cardiac remodeling, delay the progression of myocardial contractile dysfunction. They are also known to reduce mortality rates and improve survival by reducing the incidence of tachyarrhythmias in heart failure patients. They reduce the hospitalization rates, and therefore beta blockers are widely used in the management of heart failure. So now that you have understood how beta blockers are useful in the management of heart failure, in my next lecture we will understand how to select the right beta blocker and how to use beta blockers in the management of heart failure. So thank you for watching. If you find my video useful, please like and subscribe to this channel.